So, what is life like with kidney disease? Y'all have heard me talk about it at length, but what's the experience of someone that actually has it? Well, meet Brittany Dew. She's a young lady that just a few years ago was diagnosed with kidney disease, and during that time has been through a whirlwind. From being told suddenly that she had end-stage kidney disease, to being on dialysis, and then eventually getting a kidney transplant. And all the while, maintaining a really positive attitude. And today, y'all are about to meet her. What's up, San Antonio and world? I'm Dr. Qasim Butt, and I'm a kidney doctor, and I'm here to break down health in a simple way. Now, do me a favor, hit up that like and share button because it'll really help me out. Now, today is a great episode. It's an incredible episode because we're talking about kidney disease. Now, I know you guys have heard me talk about kidney disease, but for the first time, it's going to be from a different perspective. It's going to be from the patient's perspective, which is going to be like uber cool. Now, to talk about that, we're going to have an actual patient, and that patient is Brittany Dew. Brittany, how you doing?
Hello, I'm doing great.
You're doing great, awesome. And she's going to talk about her experiences because she's very young, but she's had so much experience with almost the whole spectrum of kidney disease and how it's treated in this country. So, Brittany, why don't you go ahead and introduce yourself? Tell us a little bit about yourself.
Yes. Hello, everyone. Thank you for tuning in to hear me speak on my untold story. I hope my untold story can encourage and give you hope during this time of COVID-19, health and obstacles in life. I am a kidney recipient.
No, well, that's awesome, Brittany. Right? So, I know you have kidney disease, but you are so young. You're only 23 years old at this time, right? So you're only 23. But when was the first time you were told you had kidney disease?
I was diagnosed with kidney failure on December 14, 2017.
Well, just 3 years ago. Just 3 years ago.
And found out by my lab results.
You found out by your lab results, huh?
Yes.
Wow. So now, how did you found out by your lab results, but why did you get those labs checked in the first place? Because oftentimes people your age don't need labs taken.
Right. I was a little bit malnourished.
Mm-hmm.
And then also they just want to check and see if I was doing okay because of me not really gaining weight so much.
Okay, so you've been losing weight, not eating right, and I think you had told me you had a little bit of swelling in your legs too. Is that right?
Right. My feet were like an elephant.
Oh, really? And so, guys, that's kind of the symptoms of kidney disease out there. And by the way, for those of you who are out there who have kidney disease or know people that have kidney disease, do me a favor, hit up that like button and share button so that Brittany can know you're out there. Now, you had those symptoms and you found out in an outpatient lab, right?
Right.
And then your parents, at that point, what did you do? Did you go to the hospital? How did you approach it?
Well, I had they told me I had stage 5 chronic kidney disease. And then right after that, I went to after from seeing my lab results, I went to the hospital. Right.
You went right away. So you were diagnosed with stage 5. And guys, so just so you know out there, there's 5 stages to kidney disease, 1 through 5. 1 being greater than 90%, 5 being the worst at less than 15%. So when Brittany here found out she had kidney disease, she found out she had less than 15% kidney function already. So that's kind of really bad that they found out. Now, so they told you that you had stage 5, right? Now, at stage 5, did they find out what was the cause of your kidney failure at such a young age?
No, they didn't. And they didn't even do a biopsy on me.
They didn't do a biopsy. Why is that? Why didn't they do a biopsy?
Because they thought it was going to make it worse.
I was going to make it worse. Now, so what happens is oftentimes, guys, and this is why we want to get you guys tested early, because Brittany's kind of an abnormal case, but when you're 40, 50, 60 years old, if you go to the doctor too late and you're found to have, say, stage 5, there's not much you can do. And oftentimes by that time, the kidneys are kind of pruned and small and shrunken, so there's not even a point to do a biopsy. Is that what they pretty much told you, I guess?
Yes.
Okay, so that's kind of not common, but that's what happens when you're in stage 5, and it's very uncommon for someone your age. Now, did they tell you what it possibly could be? What kind of kidney disease you possibly could have?
They said it could possibly be IgA nephropathy, and then my genetics. It could have been also maybe because I was born premature. Different possibilities.
So different possibilities. So IgA nephropathy, guys, is a common disease in people of Asian heritage, like Brittany here. But other things happen. Like you may have had some congenital issues, right? You were born premature. I remember you telling me, right?
Right.
And I'm having a little technical issues. Give me a second here. Sorry, Brittany. I'm sorry, Brittany. Technical issues. Sorry. So you were told stage 5. At that point, you were stage 5. So what did they do for you at that point? They couldn't do any treatment. So what did they decide to do for you at that point? And by the way, guys, if you're out here, please leave a comment for Brittany or any questions you have for Brittany so that she can answer them.
Right after I was released out of the hospital on December 24th, 2019, I was told they were going to put me straight right away on hemodialysis.
On hemodialysis. So you went straight to hemo, huh? So guys out there, so hemodialysis is one of the types of dialysis. It's typically 3 times a week, right? You were on Monday, Wednesday, Friday, right? They also have them on Tuesday, Thursday, Saturday. Each session is 4 hours. And what they do on dialysis is they take the blood out of you, put it in a machine, clean it for you, then return it back to you. Again, that's done 3 times a week, 4 hours each session. And how was your experience like on that, by the way?
My experience on hemodialysis, I liked it, and then there's always pros and cons. I got to engage with nurses, social workers, and then the dietitian.
Yeah,
that's the one thing I like.
So you like the community of it, right? The community aspect of it, right? Okay, that's pretty cool. But eventually you switched though, right? You changed, right? Types of hemodialysis, right?
Right. In 2019, February, I changed to peritoneal dialysis until I be on less medicine, lower my risk of infection, and lower my high blood pressure.
Wow. Okay. So guys out there, peritoneal is a different type of dialysis. It's actually peritoneal dialysis. It does involve no needles, no blood at all. What they do is take a tube, put it in your abdomen. And through that tube, they actually put fluid directly into your abdomen. Fluid sits there, kind of absorbs all the toxins, all the extra fluid, and then you drain it out. And that's typically done over an 8-hour cycle at night, right? And that's how you were on, right?
Yes.
And that's done every day, right? That's how you were doing it?
Right.
And how did you like that experience? Did you like that experience better?
I like the peritoneal dialysis better than the hemodialysis because it gave me more freedom to do work.
Yeah.
And I could do it on my own pace of schedule.
Okay, so you could do your own pace. And that's what I think a lot of people like about the peritoneal is you get to be autonomous again. You get to go back to work, go to school, do everything because you don't have to go to a clinic all the time, right? And so that was probably very beneficial to you, right?
Right.
Okay. And if everyone's out there that's on dialysis or either one peritoneal hemodialysis, give us your experiences in the comment section below. Okay. So you were on hemodialysis for some time. Then at some point, what happened? What happened after the hemo?
After the hemodialysis, I received a kidney transplant.
You got
through an anonymous donor.
And how did that anonymous donor find you?
My anonymous living donor found out through NPR radio by the pair exchange match on July 5th, 2019. I got my transplant for surgery at the University Health System by Dr. Abrahamian.
Dr. Ibrahimi, huh? Well, big shout out to University Health Systems and University Transplant Center. They do great things. I know a bunch of the surgeons and doctors there. They do incredible things. So your donation, your kidneys are actually from a altruistic donor. Someone just gave their kidney out of goodwill. They heard about it on the radio, NPR, and they just literally gave up their kidney. Is that right?
Right.
Wow. And you never met that person or anything like that?
Right.
Never met him or anything. So right now you're sitting right there with someone else's kidney you don't even know. That's pretty. But the thing is, what's funny is most people don't go that route. You know, most people don't go that route. They actually have to do a cadaver kidney, which is when someone dies, say in a car accident, they happen to match you, and that could take up to 5 years sometimes. And you were lucky enough to have someone just kind of donate, right? So, yeah. So as far as that now, like. You got the transplant. How was the experience of getting the transplant and when you were at university?
My experience at the University of Transplant Center was getting the transplant was very calm for me, and no fear of having a transplant because Dr. Abraham made sure that I had calmness and that I could.
Hey, you're breaking up. Can you hear me?
Awesome. He just told me I was breaking up.
Oh, you're okay. I can hear you now. I can hear you now. Go ahead.
Okay, hold on. I might have to put the volume down. Can you hear me now?
Yeah. You want to put your headphones on again? Sorry.
Okay. But yeah, I heard Dr. Abraham made sure I was fear with no fear or calmness, and I was really excited about getting this transplant.
Yeah. So you took a very positive light on it, right?
Yes.
Okay. Awesome.
Even people who came and visited me at the transplant was surprised that I was really excited and happy from everything that I went through.
Oh, well, cool. So you got the transplant, you get out of the hospital, and then something happened in America at that point politically. So something happened. So what happened at that point?
Right. The day I got released out of the hospital was on July 10th, 2019, when Trump did an executive order for kidney disease, which contained increase on home dialysis, kidney transplant, lower on payments, and support living kidney donors.
Yeah, so guys, and that's where we met actually, because I had done a presentation on the Trump executive order. And guys out there, the Trump executive order on kidney disease is kind of revolutionary because it changes how we treat kidney patients in this country. In particular, what it does is it actually incentivizes doctors financially and institutions financially to actually encourage kidney transplant, as opposed to being perpetually on dialysis. It also incentivizes financially these same groups and same physicians to do dialysis at home. So doing the dialysis at home has better results than when you do it at an in-center place. So it's actually a better outcome for a lot of patients, and that's why they actually incentivize it, right? So that was a big day. I mean, that was a big day. Now they're actually implementing it in 2020. I don't know how it's going with COVID-19 and everything, and how their implementation process is going with that. And speaking of COVID-19, how are you coping with COVID-19 at this point?
Yes, how I'm coping with COVID-19, like all of us, is going through a crisis in COVID-19. We all have our ups and downs. I've been staying positive and living a life filled with fun by still keeping me safe, strong, and taking my precautions with this COVID-19.
Awesome. And guys out there, we tell you in the medical community to wear masks, right? We wear masks. But we're not telling you, if you're especially like 20, 30 years old, we're not telling you just for you. We're really telling you to wear the mask for people like Brittany. Because you may be 20 and healthy, but she's 23, she's healthy, but she's on immunosuppressive medications that suppress her immune system. So if she gets COVID, it could be very bad for her. So that's why we tell you guys out there to wear those masks. Not just to protect yourself, but to protect other people that are kind of vulnerable, right? Now, besides COVID-19, now I know you're into comic books like I am. So I'm a big fan of the Avengers, Marvel, yada yada yada, Batman. But you have a special relationship with Spider-Man for some reason. And could you tell us why exactly?
Yes, I keep talking about Spider-Man within my testimony. Is because on my sonogram, my kidney image was an upside down Spider-Man.
Upside down, and
if you guys see it on the video.
Yeah, you can see it on the image right there. That's the blood going through her transplanted kidney, and you're right, it does kind of look like a Spider-Man. You're totally right. And so I guess you have a connection to Spider-Man. Now, besides Spider-Man, you also have something else really important in your life that makes a difference, and that's your faith, right? So can you tell us a little bit about your faith and how that plays a role in your life and how everything goes around?
My faith in God has been a big part of my life. How if you ask by me, never give up that I will get a transplant soon. After waiting with an unlimited diet and liquid. I honestly pray along with my church family, Oak Hills Church. If you don't get anything from my interview, please remember this acronym. Faith. Fully anticipating it to happen. We're all waiting for something like a transplant. COVID-19 to stop. Results and a job.
Yeah. So awesome. I'm glad that you have that thing in life, those things in life to kind of help you cope with everything. And you're always such in good spirits. And that's the amazing thing about you and just meeting you. So, I'm glad you can come on here and kind of share your experience with everybody. Anybody out there has questions for her, for Brittany, let us know, or just in general. Jason Benjamin Nunez says, hi, Brittany. I don't know if you know him. Veronica Rodriguez Chapa says, hi, Brittany and Dr. Butt. So there's two of us on here. But if anyone is out there, I know families out there, please give us some comments. But in the meantime, we wanted to make this a quick intro to Brittany, and that way she can, get her word out there that kidney disease is prevalent here in San Antonio and the United States as a whole. And it's good to put a face to kidney disease. You can hear me talk about kidney disease all day, but it's nice to have a face to it, right, Brittany?
Right.
And we're gonna get out of here at this point, Brittany. So why don't you tell them, huh? And remember,
Your kidneys and your health.
You got it. Thanks, guys. I appreciate it. Okay.